Good morning. My name is Roann Sexson. I'm a registered nurse, and I'd like to introduce Dr. Harvey White.
As you know from your career, we spend way too much energy, time, and money on taking care of people after they get ill. And so Vessel Health, as we've mentioned before, focuses on cardiovascular health promotion.
Excellent.
Yep.
Excellent. That's really good news. Tell me a little bit about prevention and your methods.
Well, we talked the last session about the use of non-invasive testing to determine whether or not an individual has plaque in their blood vessels.
Right.
We talked about the carotid arteries, the heart, et cetera, et cetera.
Right.
Well, we go on beyond that in a next step, and we assess an individual's cholesterol, because most all hardening occurs through some abnormality in one's cholesterol profile.
I see. So tell me about this assessment. What is it? It's a blood test? Do you do advanced blood testing? I know there is such a thing.
We do advanced blood testing.
Oh, excellent. Tell us about that.
I will. For the listeners, though, in general, if you go to a physician, family practitioner, internist, et cetera, a cholesterol profile is done, and it includes some very elemental components.
Sure.
If you look at the cholesterol panel, it generally measures the total cholesterol, measures triglycerides, and I'll come back to that, LDL, or bad cholesterol, and HDL, good cholesterol. Now, some degree of cholesterol is important. For example, triglycerides are part of our cells, the things that make up our bodies. Also, cholesterol is used to make hormones. All right, so some cholesterol is good, but excess is not good.
It's not good.
It turns out, though, that just knowing these few numbers doesn't always do the trick.
Oh, very interesting.
It doesn't.
Very
For example, what we've learned, and you may know this already, is that bad cholesterol isn't just one homogeneous compound. Cholesterol, it turns out, and I'll just draw this, is made of packets like M&Ms. All right? So there is a membrane on that packet. It's a protein in general. Like an M&M has a coat.
Sure.
And then the cholesterol sits inside.
Very interesting.
If one looks at bad cholesterol, these packets come in different sizes. And it turns out that small, dense, tiny BBs of LDL cholesterol are more problematic. You can think of them as seeping through the blood vessel wall and getting into that portion of the blood vessel wall that creates plaque. So we measure in a more sophisticated test that we call advanced lipid testing. We measure this, for example, the particle size and number of LDL.
I see. So what you're saying is that it may be necessary to take more
To go beyond.
to go beyond.
Yes,
Exactly.
to go beyond.
Exactly.
We find that very fruitful. There is a concept of residual risk. It's a very interesting concept. If you look at individuals that have been treated for their LDL, not knowing this factor here, indeed you can reduce risk of heart troubles, but you only reduce them about a third. So 60% of patients still have events on medicines for their LDL cholesterol. And we believe that is intolerable. And that is a big problem in my medical career, which involved putting stents in heart arteries and angioplasty. There were many patients I cared for who had treatment for their LDL, but insufficient because it wasn't being treated correctly, or these other numbers were also not being attended to.
So I'm just curious, Dr. White, do you do this advanced lipid testing at Vessel Health? Is this a test that is widely performed in Albuquerque, or do you do it at Vessel Health?
That's an excellent question. In general, in the past, we've had to send the blood or serum off out of town to get some of these parameters measured. And that can be done in several areas of the country. Here at Vessel Health now, we are able to draw this blood for advanced lipid testing and have it processed very quickly and get these numbers back, as well as other numbers I won't go into now, that would help us tailor our therapy just to you or another individual.
Oh, that's good news. High
is good
technology in Albuquerque at Vessel Health.
Yes.
Very
And
good.
Vessel, what we do in Albuquerque at Vessel Health should be done, in truth, to patients all over the country, or clients, you might say. And so we hope that the messages that we create at Vessel Health here in New Mexico resonate, you might say, with individuals throughout the world.
Good. So for the audience out there, if any of you are interested in having advanced lipid testing or have concerns about cholesterol, it's safe to say they could contact Vessel Health. And what is the contact information?
Well, two ways, Roann. We have a telephone number, as most people do. That's 505-828-3000. And our website is worth checking out. I mean, some of this information is on there, and that's www.vesselnm.com.
Excellent. Thank you, Dr. White.
Thank you, Roann.